This is Dr. Shanti Bansal from Houston Arrhythmia Associates. The topic of my discussion today is innovations in heart care arrhythmia management. My first case is Bob. He is a 65-year-old man. He has a history of high blood pressure. He had a heart attack at age 55. He has trouble breathing, walking upstairs, and was told he has congestive heart failure. He's a big Houston Rockets fan. He watches Rockets games. He buys a hot dog, nachos, and a beverage. He collapses and becomes unresponsive, receives bystander CPR. This is a picture of a AED which can be found at many public facilities. It analyzes the patient's heart rhythm, determines whether or not a patient needs a shock. If he does, it prompts you through the instructions to do so, and oftentimes this will be a life-saving treatment for many people who collapse. One of the big factors in patients to recover after a cardiac arrest is how fast they receive therapy, whether it's CPR or the use of AED. The more time that progresses after a patient is collapsed decreases the chance they will ultimately live from the experience. What is sudden cardiac arrest? It's when the heart unexpectedly and abruptly stops beating. It's usually caused by abnormal heart rhythm called ventricular fibrillation. It is when the electrical system in the heart malfunctions. As you can see from the picture on the right-hand side, the bottom chamber of the heart is going in a very irregular fashion, and that is preventing the blood flow from being pumped effectively to the rest of the body. Is sudden cardiac arrest the same as a heart attack? No, is the short answer. A heart attack is the death of a heart muscle tissue caused by blockage in the arteries that supply the blood to the heart. A heart attack, in simple terms, is a plumbing issue. Sudden cardiac arrest is an electrical issue that should be dealt with by an electrician of the heart. Sudden cardiac arrest is one of the leading causes of death in the United States. As you can see from this bar graph, comparing sudden cardiac arrest to AIDS, breast cancer, lung cancer, stroke, there's a higher prevalence and rate of this compared to all other medical ailments listed here. The incidence of sudden cardiac death, the most common cause of death in the United States is sudden cardiac death. It happens to 300,000 to 400,000 people every year, and only 2 to 15% reach the hospital before they expire. Half of these early survivors die before discharge. As you can see, this is a serious condition and can cause significant impairments. And therefore, as electricians of the heart, we do try to prevent these and treat people like this. One of the ways that we treat patients who are able to survive a sudden cardiac arrest is through a implantable Cardioverter Defibrillator, or ICD for short. It is a device that sits near your collarbone and your shoulder. It monitors your heart rhythm 24 hours a day and will restart your heart in case it were to stop for any reason. It is a relatively short procedure, and patients are usually discharged the next day if they're doing well. My second topic that I like to talk about is atrial fibrillation. This is a case study of Joy. She's a 55-year-old female. She has recurrent palpitations associated with lightheadedness, easy fatigability, shortness of breath, limiting her activities. Palpitations are increasing in frequency and duration. EKG shows atrial fibrillation. This is an example and cutout of the heart. As you can see from this arrow here in the green, this is an example of a cutout of the heart, both in the top chamber and the bottom chamber. Atrial fibrillation most commonly comes from the veins that plug into the left side of the These veins and the cardiac tissue that surrounds the veins is responsible for abnormal heart signals that can hijack your normal electrical system. There are a lot of causes for atrial fibrillation, one of which is because of abnormalities with the heart, from high blood pressure to blockages in your heart to valves within your heart that are not working appropriately. There are also non-cardiac causes, which can be from lungs that are not working as well as they should, problems with your thyroid, or with the nutrients within your bloodstream. And all of this can contribute to arrhythmias that are happening in the top chamber of the heart. There are different forms of atrial fibrillation. There are some that come in and out, called paroxysmal atrial fibrillation. Another form is called persistent atrial fibrillation, which lasts longer, usually up to a week at a time. And there's permanent atrial fibrillation, which you have constantly and does not ever go back to normal. The problem with atrial fibrillation is twofold. One, patients oftentimes don't feel well with this, in that they can have shortness of breath, palpitations, and generally not feel well. The other issue with this is that it can cause strokes. There's a risk of 5 to 7 times greater for people with atrial fibrillation to have strokes. In addition, it's responsible for 70,000 strokes per year. And this is because the top chamber of the heart is no longer able to contract normally. In fact, it is just quivering. And the quivering of this portion of the heart causes blood to flow much more slowly and form clots. These clots can go to the brain and cause strokes. So this is a slide showing the prevalence and incidence of atrial fibrillation. As you can see, there are millions of people, both in the United States and worldwide, that have atrial fibrillation. And there's a growing number of patients who are developing this, especially as the population ages. This arrhythmia will affect both men and women equally, with men affected at a slightly higher incidence or rate as they get older. There are a lot of treatments for atrial fibrillation, including medications, monitoring of the heart rhythm, blood thinners, and shock treatment, and last of all, ablations. Ablations probably are the most effective way to deal with many patients' atrial fibrillation. Atrial fibrillation is a very difficult disease to treat, by medications alone, and oftentimes will require some form of intervention to eliminate or drastically reduce one's atrial fibrillation. At Hermann Memorial Southwest Hospital, this is done frequently to eliminate atrial fibrillation by burning the abnormal tissue that I spoke about near the veins that connect into the left side of the heart. By burning these abnormal signals out, you can bring back the heart's normal electrical system. And oftentimes with that, patients will feel better, and you will keep the heart out of abnormal heart rhythm with this technique. This can be done in conjunction with medications or other forms of therapy as well. For some types of atrial fibrillation, this is the most effective way to deal with this situation. This is a picture of my partner who is using one of the latest robotic arms to effectively eliminate those abnormal heart signals that I talked about earlier. At Southwest, we have a number of technologies, including cryoballoon, a freezing technology, a burning technology as well to eliminate the abnormal heart signals inside the heart. Also has robotic systems available to us in the latest technology to effectively manage this. This is a 3D rendering of the heart that we oftentimes will obtain before doing ablations for atrial fibrillation. This gives us a roadmap of where to go when we get inside the heart itself. This is a schematic of one of our patients that received pulmonary vein isolation, and we made a number of burns within the heart itself, eliminated his atrial fibrillation, and subsequently he did very well. I don't trust those new finangled battery-powered pacemakers. This is a little cartoon I found that shows this patient being wound up here by a key. Your new pacemaker operates on the same principles as a bumper car at an amusement park. And once again, this is Shanti Bansal talking about sudden cardiac arrest and atrial fibrillation. Both of these entities are very troublesome for many patients. They've caused a lot of symptoms for patients. They've also caused a lot of hospitalizations as well. And both of them can be dealt with in a very effective manner through devices or through ablations. If you've had problems with either one, they really should be seen by a electrophysiologist or a heart rhythm doctor who knows how to deal with them effectively. We have clinic locations at Hermann Memorial Southwest, Memorial City, Katy, Sugar Land, and at Willowbrook. We hope to see you at some time and point. Thank you for your time and attention.